Hi class. In this lesson we will review stimulants. These drugs enhance neuronal excitation for the most part. There are two indications for these medications, either ADHD or attention deficit hyperactivity disorder, or they could be used for narcolepsy. We're going to focus our attention on their use for ADHD, and we'll also talk about some non-stimulant drugs that are used to treat ADHD.
So the objectives are listed on the slide, and they're also listed in the Blackboard module for stimulants. There are some new vocabulary words, so take a look at those and look them up if you're not sure what they mean. Okay, so let's start off and briefly talk about attention deficit hyperactivity disorder. So this is the most common neuropsychiatric disorder of childhood. It is 2 to 3 times more likely in boys than it is in girls. Generally, symptoms start to emerge around age 3, or really any time below the age of 7 years, but can persist into adulthood, into their teens, and even into adulthood. And you can see 30 to 60% of cases actually will persist into adulthood. Symptoms that you might see in adulthood: poor concentration, stress intolerance, antisocial behavior, anger outbursts, inability to maintain routine. And obviously, these are symptoms that can be debilitating, just like the symptoms in childhood of inattention or hyperactivity or even impulsivity. The good thing about ADHD is that it's pretty responsive to drug therapy. About 60 to 70% of kids will respond completely to drug therapy. Pharmacology. So there's not a whole lot of pathophys or background that we want to talk about. I just wanted to kind of give you the general picture of ADHD, but let's really focus on the drugs that are used to treat ADHD. So there are two classes, the stimulants and the non-stimulants. And so the stimulants, the two classes that we all talk about are the amphetamines and the amphetamine-like drugs. The good thing is that pharmacologically, these are almost identical. So when you begin studying the amphetamines and the amphetamine-like drugs, really you're basically just studying the effects and the adverse effects, the therapeutic use, the adverse effects, the nursing implications, and they're going to be almost identical for these two drug classes. So amphetamines, the prototype drug is Adderall. That's the brand name. The generic name is amphetamine dextroamphetamine. This is a mixture of two different molecules. These act by releasing norepinephrine and dopamine, and also by inhibiting reuptake. They're used for ADHD, but they can also be used for narcolepsy. Adverse effects, I think these are going to be very obvious, right? So CNS stimulation, they're stimulants. Of course, they cause CNS stimulation. They can cause weight loss. They can cause headaches or even abdominal pain. And they can even cause lethargy. They're Schedule 2. Remember, these drugs are a controlled substance. These are Schedule 2, which is the highest regulatory category of those that can be provided by prescription. I mean, we also have Schedule 1, but those are drugs that we generally say don't have a therapeutic use. Schedule 2 drugs have a therapeutic use, but their propensity to cause tolerance and dependence or addiction is very high. These drugs should not be used in patients with symptomatic cardiovascular disease, and that's just because of the stimulant effect that they can have on the heart. And then in terms of nursing implications, generally patients are advised to take the dose right after breakfast, and then their second dose right before, sometime before 4 p.m. And that's because they can cause insomnia because of their stimulant effects. And so if they're given any later than that, the patient can have difficulty sleeping. And for children, that can actually worsen their behavior. So if they're prescribed these medications because they've got behavioral issues, and then they're staying up really late because they can't sleep, rather than improving their symptoms, that can actually worsen their symptoms. So this can be very, very important patient education, and particularly for children. All right, so the amphetamine-like drug, which is methylphenidate or Ritalin. I'm guessing most of you have heard of Ritalin. This is a pretty well-known drug, even amongst the general population. This drug also promotes norepinephrine and dopamine release and inhibits reuptake, basically increasing the amount of norepinephrine and dopamine at the receptor site to cause action. Therapeutic use, ADHD is the primary use, but these could also be used for narcolepsy. Again, these are Schedule 2, just like the amphetamines, so they can cause tolerance and dependence and addiction. Individual variation, again, same as the amphetamines. You have to be very cautious using these. If the patient has symptomatic cardiovascular disease, they should not be used. And again, counseling your patients on when to take these medications is important. Some safety concerns with the amphetamines and the amphetamine-like drugs. Withdrawal symptoms can occur with abrupt discontinuation. Patients can also experience an overdose syndrome. So dizziness, confusion, hallucinations. They can even become delusional. They can have heart palpitations or dysrhythmias, or even high blood pressure. So monitoring for those effects is important. Another problem with these drugs from a safety perspective is that there are lots of different dosage forms. So there are immediate release products, there are sustained release products, there are extended release products. Sometimes they're dosed once a day, sometimes they're dosed 2 or 3 times a day, sometimes they're dosed just 2 times a day. It can be very confusing, and making sure you've got the right dosage form is important. Finally, there is a patch formulation of this product. And so there can be some hypersensitivity reactions associated with that, some skin reactions. Also, remember all of those safety concerns with patches. Those all will apply to this drug. All right, so let's move on to the second type of medication used for ADHD. These are the non-stimulants. The only one that I'm going to talk about is atomoxetine or Strattera. I did put on the slide bufenicin, brand name Intuniv, or clonidine, brand name Catapress. Those are used, but they're really second or even third line agents. So really, that's just more informational for you guys. The one I want you to know is atomoxetine. Even atomoxetine is a second line drug. These drugs are not superior to stimulants. When they're tested head to head, stimulants win. They are definitely more effective at preventing symptoms. However, if you've got a patient where there's concern for stimulant abuse, or where there's just a strong aversion to therapy, maybe the patient's family doesn't want the patient on a stimulant, maybe they're worried about side effects of the stimulants. In that case, it's appropriate to potentially try atomoxetine or Strattera. So atomoxetine, it works by inhibiting norepinephrine reuptake. As I said, its use is in ADHD, but it is a second-line drug. Adverse effects, generally it's well tolerated, but patients do sometimes report GI reactions or allergic reactions. Suicidal thinking can be increased with this medication, so that's absolutely something that should be monitored for. Sometimes these patients experience weight loss and even growth delay, which can be concerning in your adolescent population. And the other major concern is severe liver injury. You have to counsel patients that they need to watch for the signs and symptoms of liver injury. And you guys should know that that is the principal side effect of concern with this medication. The other main thing that's important to know is that this drug can have serious drug-drug interactions with MAOI inhibitors. It can lead to serotonin syndrome. So making sure this drug is not used with MAOI inhibitors is very important. And now, luckily, this drug is not a controlled substance, so it doesn't have all of the special precautions around handling like the other 2 drugs that we talked about will have. All right, and that's it. So stimulants is a pretty quick and easy lecture. Like I said, we focus mostly on ADHD. We talk about both stimulants and non-stimulants used for ADHD. I think these drugs are pretty straightforward, pretty easy to understand and to remember. But if you have questions, please post them on the discussion board. Thank you for listening.